to welcome you to our session today. We have Layla Kwong here to speak with us. She's an assistant professor in environmental health sciences, and she has some work to present on which she is very much hoping for engagement and feedback. So don't just turn your camera off and go, half paying attention. We got to focus on this one, be engaged, and get Layla the helpful feedback she would like. So I'm going to take down this welcome screen so that Layla can share her screen and we can get started.
Hi, everyone. Thanks so much for joining today. I am sitting at a conference in North Carolina and have escaped to a hallway, but I'm not guaranteeing there will not be any background noise. So sorry about that in advance if that happens. As Jen mentioned, I'm really excited to get your feedback. So today I'll be talking about a new proposal / set of proposals on quantifying and mitigating heat stress in Bangladesh. And the type of feedback that I'm looking for is like, what should we add to this study, right? There's so many questions to be answered here. I'm an expert in, but a few things and still working on that. And, other people are experts in different things. Other people have different ideas for, what data to collect, what's important, how to look at things. And so I'm very open to other ideas of things to look at, other methods that I haven't included. So I'm happy to take questions throughout, and then there will be some time at the end. So yeah, what should we add? What do you personally want to add as a collaborator if you want to do that? And then do you have ideas for people that I should talk to? Okay, so the reason that we're looking at extreme heat is because it's an increasing problem, right? As we all know, extreme heat can lead to physical health problems, dehydration, heat stroke, including death. It can have chronic impacts. An evaluation of global burden of disease has found an elevated risk of chronic respiratory infections, cardiovascular disease, all-cause mortality. There could be mental health impacts, pregnancy outcome impacts, and then cascading impacts, right? Like who wants to go exercise, which is the healthy thing to do, but who wants to go exercise when it's, 95 degrees outside, right? And so there's a range of impacts that we might want to look at. And the problems are really getting a lot worse, right? So it's estimated that between 2000 and 2009, there were over 480 deaths from extreme temperatures. 37% of those were directly attributed to climate change. And the estimate is by the end of the century, 3.6% of all GDP will be lost to mortality or adaptation to extreme temperatures, right? A lot of that is the cost of cooling in countries that afford to cool and the cost of death in countries that cannot afford to cool. So, that's a really, really big number, a big percent of GDP, a big percent of total mortality losses. And these are from extreme temperatures, right? It's estimated that will outweigh all cancers and all infectious diseases. Now, I want to point out here, this is extreme temperatures. Of course, we talk a lot about extreme heat, but currently about 10 times more people die from cold stress than heat stress. So as the climate continues to warm, there will be fewer deaths from cold stress and more from heat stress. But that's just sort of like a sort of unacknowledged fact that there are actually a lot of deaths from cold stress right now, and those will be alleviated as the temperature continues to warm. So I also want to, point out that temperature is not the same as heat stress, right? Heat stress is actually a combination of temperature, humidity, airspeed, radiation, solar radiation, the clothing that you have on, and your metabolic activity, right? So some of this is thinking about how much heat are you generating internally? How much are you able to sweat? How much is that sweat able to evaporate, right? Either because of the humidity's differences or because wind is helping, pull that off of your skin. And so remembering here that we can't just look at temperatures when we're considering heat stress. We need to look at a combination of factors. The field of heat has not coalesced on how you should combine those factors to best assess someone's stress, right? And so there's like 64 indicators that people have developed to think about how you should combine those different factors. And there was recently analysis from 2020 on, which of those seem the best based on a number of criteria that experts have put together. Right. So the ones that seem the best are the wet bulb globe temperature, indoor and outdoor, and the universal thermal climate index. And one reason that these three were ranked quite high is because they all include sort of like public health guidance around different levels of stress associated with these indicators. So when I calculate indicators to determine heat stress among different populations, I'll look at these three, but I might look at a lot of other ones as well, because it's really not clear yet which of these have the most usefulness for public health and public health guidance. Okay, so which ones will I include? Probably the wet bulb globe temperature. Again, this includes temperature, humidity, wind speed, radiation, and you can modify the equation if you're considering clothing and metabolic activity. And this is really important because we'll be looking at people who are doing outside work, some of them. It's, you know, sort of more recently evaluated that the upper limit of human survivability is 35 degrees centigrade. But new work shows that there's not one single temperature because, you know, different people are producing different amounts of metabolic activity, right? And so there's probably a range from 24 to 37 degrees Celsius, which is the upper limit of human survivability. And the upper limit of human productivity for someone who's acclimatized, someone who lives in that context all the time, is probably from 20 to 32 degrees. And these are important because we look at these as thresholds in our data. We might look at hours that someone is above 35 degrees Celsius or hours that someone is above 33 degrees Celsius as an indicator of sort of how stressed they are. The other one we'll use is the Universal Thermal Climate Index, which is a combination, again, of all of these variables, but it assumes certain types of clothing and assumes that you're in shade, which, again, may not be true for some people, you know, at all times during the day when we're measuring it. So there's some groups that are more susceptible and there are some groups that are more vulnerable. So increased susceptibility, sort of in a risk assessment framework, means that you have a stronger response to the exposure. So your body is going to respond more strongly to heat stress than someone else's body. This includes children, pregnant people and their fetuses, women, older people, chronically ill people. And some groups are more vulnerable. Those include outdoor workers because they have higher exposure. They're just in the heat more hours. And then people without access to cooling. And the reason for this is due to the thermal physiology. So this is not a physiology class. We're not going through this whole diagram, but you can sort of see at the starting point, when you're heating up, your blood vessels dilate, they get bigger, right? That decreases your blood pressure and it makes your heart work harder, right? When your heart is working harder, these other things are also happening. You're sweating more, you're losing fluid, right? And then you sort of don't have enough fluid in your blood. And that can cause sort of leakage in your gut and endotoxins to enter your gut and then cell death. And so some reason that those groups are more susceptible is because they already sort of have these conditions that are predisposing them. So for pregnant women, they would have extra blood and a high metabolism, right? They have a whole fetus that's also metabolizing, so they're generating a lot of heat. Children, they already have high core temperatures and they have lower sweat rates than adults. And then females have a higher surface area to mass ratio than men, and they sweat less than males. And so those factors all make them more susceptible. So we'll pay close attention to those groups in our study. All right, so here's a study of pregnancy outcomes. This is a pretty recent meta-analysis. The only point here of this diagram is to show that there are risks for heat stress and adverse pregnancy outcomes. So heat stress has been associated with preterm birth, low birth weight, and stillbirth weight, with odds ratios about 0.05 to 1.15. The reason we're not going into any details of this is because there aren't very many studies, particularly in low and middle income countries, and because the studies that do exist have inconsistent definitions of exposure, none with biological justification, right? So these studies might say, you know, what was the woman's exposure to heat in her last trimester? You know, what was the average temperature? What was the maximum in the last week of the first trimester, right? So they're not really consistent. And so that's why I'm not, you know, putting too much weight on the actual odds ratios that have been defined here. Okay, so another group that we'll look at are rickshaw pullers. If you have been to another country, particularly in South Asia, you may be very familiar with that, but some people might not be. So I just wanted to give you an overview of a rickshaw puller in Dhaka. So this is a person who is riding a bicycle, and there's a seat on the back of the bicycle, and you can have 1 to 4 people sitting in that seat, maybe 400 pounds that you're pulling around. In Dhaka, there's 1.5 million rickshaw pullers. They are all men, as far as any research or observation has found. 90% of rickshaw 90% of rickshaw drivers have rickshaw pulling as their only source of income. People work a lot, right? You don't make very much money doing this job, and so you need to work a lot. And even when you do, you're making about $3 a day. 81% of rickshaw pullers smoke, and they spend a lot of money on these cigarettes. After cigarettes, renting their rickshaw, and renting their house, that income only is about 50 cents per day, right? So we're talking about a very, very low income population. And you can keep that in mind when we're talking about interventions. Additionally, 95% live in corrugated iron houses, right? So they get really hot when you're living in a small box that is made out of iron. And people have very high exposure to air pollution because, of course, these rickshaw drivers are sharing the road with buses and, compressed natural gas cars. And just a lot of like road dust. So that's another thing to keep in mind is the co-occurrence of these environmental stressors, right? Not just heat, but also particulate matter and additional factors among the individuals, such as smoking, can be really important. All right, the other group that we're interested in is children. Very young children have a low sweat rate and therefore inadequate cooling. One study in India, rural India, found that there were 2 infant deaths for every 1,000 births, not just because of sort of stillbirths or preterm births that I was mentioning before from in utero exposure, but from impacts afterwards that might include, lower crop yields because it's hot, right? And then poor nutrition after that. Studies from West Africa looking at DHS data have also estimated that will be an increase in stunting for similar reasons. But there's hardly any data on children, and there's hardly any data on these other groups that are in low-income countries. And the reason it's important that we focus on the low-income country setting is because the studies from high-income countries, most people spend most of their time indoors, and most of those people have access to indoor cooling, right? There are definitely people in the United States who do not have enough cooling. There are definitely people in the United States and other high-income countries who, are outdoor workers and need greater protection from heat stress. But most of the studies don't focus on those populations. And so that's why I think complementing the data that currently exists with data from low-income countries and specifically from Bangladesh will be quite helpful. So some of the solutions we might consider are active cooling, right? That means you need energy, and that could be a fan, an air conditioner, heat pumps are becoming more popular, or passive solutions where no energy is required. And that could be something like natural ventilation, improving your insulation, having a reflective coating or shadings on your house. We know that you can cool your house this way, right? So that's not really the question. The question is, what is the cost of these and what's the cost and benefits of these in the low income, urban and rural context that will work in Bangladesh, right? What can folks in these settings actually afford? What can they maintain? What is, acceptable and feasible for them? And so this leads to sort of a combination of studies, which I'll present quite quickly. But again, I'm really, really interested in your feedback. So at any point, raise your hand or put on the chat or just unmute yourself and feel free to ask questions. So the first study is about identifying relevant definitions for exposure to heat stress during pregnancy. And we're interested in sort of what temperatures and relative humidities are important for what duration and when during pregnancy. And the second study will quantify heat stress and qualitatively identify impacts. We'll be looking at urban informal settlements, looking at women of childbearing age, men over 40, rickshaw pullers, and children under 2, as well as rural pregnant women. In the third study, we'll look at mitigating heat stress in homes in informal settlements. And we're focusing on the urban area there because heat stress is likely to be a much greater problem in the home rather than in the rural area where homes are a lot bigger and there's more space. And again, in this, we're primarily looking at cost and cost effectiveness analyses rather than, does an air conditioner work, right? We wouldn't look at that because number one, it's not feasible. And we wouldn't look at some of the other strategies just for their ability to work because we already know they work. This is more of an implementation science question and a cost effectiveness question. We're also thinking about sort of working on documenting power structures influencing heat governance, and this would be with Zoe Hampstead, and sort of arguing for the right to cooling, and that would be with Rohini Har. I don't exactly know who is on the call right now, but I'm hoping that some of the collaborators that I'm working on these projects with are on the call, and if they are, I'd be happy if you guys also help me answer questions. So again, the reason that we're interested in Bangladesh is because it is a lower middle income country that has a lot of people, a lot of people. It's the eighth most populated country in the world. And it has a lot of people at high risk because a lot of people don't have money for cooling strategies in their homes. So South Asia faces the greatest losses in disability adjusted life years due to heat stress, and climate change is projected to make these regions even more vulnerable. And we're specifically interested in informal settlements because these communities are at elevated risk of heat from poor quality of very densely packed housing and housing materials. And I'll show you some housing that you can see how, in these areas, it's very, very hard to get sort of cool winds of fresh air. We're also interested in passive strategies because Bangladesh has had increasing electrification, but lately has had a lot of power cuts. And so we can't just rely on active strategies to address the issues of heat. Okay. This has been in the newspaper recently. Bangladesh has had a foreign currency shortage, which means they can't buy the fuel that they need to power their electricity plants. So even at night, people are losing electricity and they're not able to run their fans. So this isn't just heat exposure during the day. We're also interested in what elevated temperatures at night might be doing to sleep, right, and recovery during sleep. Okay, so study number 1. Oh, I'm seeing some chat messages. Oh, I can't show the chat all at the same time. I'm trying. Okay. Okay, there was one question. Okay, how about I'll answer the chat questions at the end because they're hard for me to look at the same time. And if you have a live question, you can unmute yourself and I'll try to pause anymore. So is there a question that I should answer right now? The one question in the chat is asking about how long people need to be in cooled areas to sort of reduce the impacts of heat stress. So maybe you can't be in a cooled area all the time, but how long might you need to be in a cooled area to sort of go back to baseline? That's a good question. I think it depends on sort of how heat stressed you are to start with, right? So if you're facing a lot of heat stress, going to a cooled area might, for a short time might be insufficient. You might need to go for a longer time or have, ice packs applied to your, head or armpits or something like that. But I think baseline understanding of what heat stress exposures are will help us understand, maybe what we would need to look for in terms of how much cooling people would actually need. Are there any other questions on anything I've already presented, sort of just the background and the basic idea? Okay, I'll make sure to pause after each study so people can ask questions. So the first study is on defining what relevant exposures are when pregnant that might have influence on pregnancy outcomes. Currently, no standard definition exists. And this kind of makes sense because the amount of heat stress that's relevant depends on the individual, sort of their degree of susceptibility and the outcome. There's likely different mechanisms, physiological mechanisms for the impact of heat on miscarriage, preterm birth or low birth weight. For example, if you had chronic heat stress and the blood from the uterus was continuously being pulled away to the peripheries so that, the mother could cool down. This could lead to a low birth weight child because they're not getting enough, blood flow and nutrition. But if you had maybe just a few days of very, very high temperatures, maybe that could result in a preterm birth, right? Where the child is, maybe almost ready to be born. And the body is like, we got to get this baby out of here because it's really, really hot, right? And there's too much metabolism internal for the mother to be safe. And so we want to interrogate those mechanisms by using a data set of children, a birth cohort that's existing in Bangladesh called the CHAMPS data set. It's actually a 6-country study, and we might add more data sets from birth cohorts to retrospectively define the mother's nighttime and daytime heat stress during each hour of her pregnancy. And the idea would be then to use machine learning to identify heat stress levels, durations, and times during pregnancy that are associated with different pregnancy outcomes. Then evaluate these models for physiological justifiability, right? Machine learning leads to a whole lot of things that might not make any sense at all. And so working with pediatric thermal physiologists to better understand, which of those actually make sense. And then selecting models and indicators with the best justification and correlations, right? So that's really like a key foundational thing to start with, is defining what exposure even is. Okay, so that is with Alejandro Schuler. Are there any questions on this? Sort of, we're still developing it, but I'd be happy for any input people have on sort of other factors we might want to consider. Okay, we think that machine learning will be a really interesting way to look at it, because machine learning is good for when you have, lots and lots of pieces of data, but none of them give you very much information individually. And it's only when you put those pieces of data together in many different ways and try many different combinations to see their impact, to see their correlation with the outcome, that you'll be able to maybe find a trend, right? So I'm excited now that we have the sort of statistical tools to be able to do that. There definitely is a limitation here that, using satellite data doesn't necessarily predict well the heat stress of a person who's on the ground. And our next study will go into that and look at that correlation. So the next study is really to document heat stress. And we're interested in documenting it sort of according to housing type so that we can plan for the intervention in study 3. So in this study, the outcome is the number of hours that the wet bulb globe temperature is over 35 Celsius. Remember, that's the sort of human limit of survivability, or over 33 Celsius, which is the human limit of productivity. We'll also look at the number of hours over, certain thresholds in the Universal Thermal Climate Index, and then the miscarriages, stillbirths, and premature births, and low birth weights that happen. So this will be a cross-sectional study design that is both in an urban and rural area. So the way that we've thought about the sample size is that we want enough people that we can get each of these 3 housing types. So instead of stratifying by housing types, we're going to enroll enough people that, based on what we know about, what % of people already live in these housing types, that we'll just sort of get enough samples in each group that we'll be able to analyze them. So in the urban area, we'll select 290 individuals in, oh, sorry, we are stratifying, I forgot that. We'll select 290 individuals in each arm. And the part where we're not stratifying is the sort of type of individuals that we're enrolling, right? So we are interested in women of childbearing age, we are interested in rickshaw pullers, we are interested in men over 40 and children under 2. And we think that sort of by selecting 290, we'll get enough of people in each of those categories that we'll be able to do sort of subgroup analyses on them. In the rural area, we're working with an existing birth cohort. And so we're sort of limited on who we enroll, but we'll enroll like 35 pregnant women in each arm. And then I just want to show you, this is sort of the house that the type of house that people are living in. It's corrugated iron. It's about 3 by 3 meters, and often there's 4 to 5 people living in a house like this. It's very low walls, about 2-meter walls. And sometimes there's a gap here between the wall and the roof, and air can kind of go in and out. And sometimes there's not a gap. Most houses do have a fan, but they don't have any other openings other than the door. And even when people do have windows, they keep them closed, because if you open your window, then everyone can see into your whole life, right? And so for privacy reasons, people often keep a window closed. So that's kind of the situation that we're in. And the idea of the study is to sort of measure baseline heat stress and measure it both at the personal level, sort of the indoor-outdoor level, and the ambient level. And this, again, is because most of the data we have right now is based on satellite imagery, and it allows us to calculate sort of land temperatures and sort of estimate relative humidities and wind speeds. But how well does that correlate with personal data? So the idea is to give people these little watches that have an I button on them, and the I button will capture the air temperature right where the person is, right? So we're not trying to capture their skin temperature. We're trying to capture the air temperature and the relative humidity sort of right around them. And then we'll also have them wear like a Fitbit to calculate their metabolic activity, I should say estimate their metabolic activity, and then have surveys that collect information on their clothing. And then we'll collect indoor-outdoor data, right? It's a lot of work to give people sensors. It's a lot of work to make sure those sensors don't get lost or stolen. And so what if we just were having sensors that were indoors or outdoors? And we knew how much time people spent indoors and outdoors. Can we sort of approximate their heat stress in that way? So we'll put air temperature, relative humidity, sort of airspeed and radiation sensors indoors and outdoors. And then we'll have people wear a light sensor, which will help us understand if they're indoors and outdoors, and do a recall questionnaire, sort of in the last 24 hours, where were you? So we'll have these 3 ways of estimating people's heat stress, and we'll assess the correlation between them. For later analyses, we'll also measure PM 2.5 and pulse oximetry as covariates for the health analysis. All right, any questions on study 2? Remember, I'm really hoping for your feedback. So if you think I should collect other information, now's a great time.
Hi, I have a question.
Yeah.
Hi, my name is Gabby Brewer, and I'm a researcher at the University of Connecticut in the Department of Kinesiology, and I study thermal physiology. So really
Cool.
interested to hear about your proposal, and would definitely love to chat after. And I just had one quick question. In addition to any personal data, did you have any future plans to monitor their core temperatures? I know that's incredibly challenging and expensive in the field. But think it could, really provide some novel data maybe as a part 2. So I just wanted to get your thoughts on that.
Yeah, I'm definitely interested in that. I know there's that pill that people swallow that has RF, and I'm interested in exploring it. I mean, it's not cheap, but it's also not as expensive as I originally thought it was, which is why I kind of wrote it off. I haven't really looked into it, and I don't know if you need to recover the pill. I mean, people are defecating into latrines here, and they're not like toilets where you can like recover that thing. So I'm not sure.
You don't need to. There's some monitors, and I'm
Okay.
happy to give you some more information offline if you were interested. But
I think if we can find the money or the collaborators to bring that in, I think it would be helpful, because there's very little data about personal exposure to heat. And by very little, I mean like 1 study in Baltimore and like 1 study of outdoor workers, I think, in Atlanta. And so it would be really helpful to correlate personal heat stress measures with the core temperatures, right? And sort of see how well they align with the models, which suggest that core temperatures, start rising at certain rates, right? And those models are often based on healthy college students, right, who are exercising in a hot room, which is like quite different than the population that we're working with and the setting that we're working with. So yeah, I think it could be really valuable to add that. So great, thanks for your question. We'll follow up
I'll send you an email after this. Thank you so much.
Great. Okay. All right, great. So study number 3. Now we're using all of that heat stress data, and we're working on interventions. So I'm an interventionist at heart. I'm very unsatisfied with just describing the problem, and I always want to work towards what more can we do? And this is really part of my sort of like environmental health justice theme. So on the intervention side, We'll be looking at the impact and cost effectiveness of interventions, and we'll do it in 3 steps. The first one is to identify interventions that are feasible, acceptable, and low cost, and likely to substantially reduce indoor wet bulb globe temperatures. The second aim will use a pre-post trial to evaluate the impact of these interventions on indoor wet bulb globe temperatures. And then the third one will use a randomized control trial to evaluate the impact of these cooling interventions, indoor cooling interventions, on heat-related biomarkers. So for that first study, this is with Carlos Duarte at the Center for Built Environment at Berkeley. We'll be using Energy Plus to evaluate a set of interventions. The interventions will be selected based on focus groups with carpenters, landlords, and residents. And then we'll run them through Energy Plus, which is like allows us to model the impact of the intervention on temperature conditions in temperature and relative humidity in the house. And some of the interventions will include our like fans, improved windows, shading, walls, roof assemblies. Those are just the ideas, and we'll further refine that with the focus group, right? This is because it would be really, really expensive to conduct a randomized control trial with all of these interventions, right? 12 arms of a study. And so we're really trying to narrow it down and figure out what's going to be feasible and acceptable for the community from the start. So once we figure out from this modeling exercise and the focus groups, you know, which interventions look promising, we'll do a second phase where we select probably 4 to 6 interventions when we look at empirical changes in wet bulb globe temperature in the house and how people actually react to the intervention in their house, right? You can say something is feasible or acceptable, but once it's actually installed in your house, you might feel differently about it. So in this, we'll have about 17 houses per arm. Oh, sorry, this was to say per arm. And it'll be a pre-post study. And that's with Saiful Islam, who's an architect at North-South University in Bangladesh. Then in the third phase with Deepak Mitra, who's at North-South and an epidemiologist, we'll look at heart rate and heart rate variability as the primary outcome. So really linking this back to human health. All right, so we have an intervention. We found some interventions that are able to lower indoor wet bulb globe temperatures in this context and are acceptable and feasible. Now, how much do they actually help with human health? So some things that we'll look at in addition to heart rate and heart rate variability are blood pressure, sort of thermal comfort that's self-reported, listlessness, fatigue, and again, the sort of hours above those threshold temperatures that we mentioned earlier. Also considering looking at maybe heat shock proteins or epigenetic changes with Andres Cardenas. So this would be a randomized control trial where there's about 153 households per arm. And we'll test 2 interventions from phase 2 in addition to having a control arm. All right, any questions about these 3 parts of study 3, where we're doing modeling, and then we're doing a sort of small scale environmental assessment, and then a larger human health assessment?
I do have a quick question. Oh, hi, my name is Marley Zalay. Thank you so much for this information. And I'm sure that you've thought through all of this, but I was just curious about the actual measures, the data from the Fitbit. And if you've looked, you can disregard my question in the chat about this, but just in terms of the precision of that data,
yeah.
I know that Annika is helping to look into that now, but I'm interested in if that's a precise enough measure to be able to calculate heart rate variability.
That is a great question, Marley. So I had 2 students go over the summer to work with a different watch, the Amazon GTS watch, which also has been sort of used in prior studies. I won't say that any of these watches have been like validated in sort of the clinical sense, like comparing it to sort of EKGs or something like that. But some have been used in prior studies and some have been used in comparison studies. The problem with that Amazon watch is that we needed a smartphone for each watch. And we were like, oh no, we can't afford a smartwatch and a smartphone for each participant. Like that's not in our budget. So then we decided to work with Fitbits. And I mean, decided means not decided yet. I have 5 of them and we're still seeing like, can we connect them as we plan? But yeah, the precision of those watches is a really good question. And the precision, let's say if they're not fit correctly, right? Like what if someone has it that's like slightly too loose or something like that? So there's a lot of work that we still need to do on like which watch and how are we going to get people to actually wear it and how are we going to get people to wear it and not sell it? So I'll follow up with you and Anika. Anika's actually, I didn't mention her, but her name, but she is going to help lead the rickshaw part, hopefully. And so we're really interested in see what metabolic outcomes and heart rate outcomes we get them. But yeah, I'd love to follow up with you, Marley, on watches that you're looking at, because it's not exactly clear which one we should use. And Fitbit is
Thank
just
you.
my latest front runner.
Thank you so much. Yeah, I'd love to talk more.
Okay. Anyone else have a question?
There's a question in the chat about how do you plan to ensure that people adhere to the rules and that they actually wear the Fitbit or wear the
Yes.
watch?
You know, you can only do so much in field research. So the current thinking is that we should incentivize them to return the watch with X days of data. And X will be dependent on how long it takes people to get annoyed with the watch. So we might, you know, we might try 2 days, 3 days, 5 days, 7 days, and just see how it goes. I mean, sort of our original ideal plan is to capture, you know, for a week, just see what happens, right? Because there could be variation in people's activities over the week. And so we'd really like to capture one individual for a whole week. But I will tell you, I got that Fitbit and I did not like wearing it. Right. I tried it on myself and I had very low compliance, even though I was incentivized to look at my own data and I didn't do it. So, you know, I know lots of people have these types of watches and, you know, probably you just get used to it after a couple of days and then you feel naked if you're not wearing it or something. But most people in these settings do not wear watches. And we are worried they will be sold. And so we will have to we'll have to think more about what to do. If anyone has other great ideas, that'd be great. But we're currently thinking about incentivizing them if they bring back the watch with a certain amount of data, right? So we both get the equipment back and we make sure it has some data on it. I think it's also going to be a lot of visits and a lot of text messages that were like, hey, are you wearing that watch? You know, another annoying thing about a Fitbit is that you have to turn it on to sleep mode before you go to sleep. It doesn't just like recognize that you're asleep because you haven't moved for an hour. You know, you have to like turn it on to sleep mode. And so if we want to get information on sleep quality, we'd also need to remind them to turn it on before they go to sleep. And I'm afraid people are going to be quite annoyed with our text, but let's see how it goes. I am hoping that some people will be really excited about it, just because it's information that they sort of wouldn't otherwise be able to get. But I also know that my housemate, you know, complains to me in the morning because he's like, oh, my watch says I slept poorly last night. And I was like, well, how do you feel about how you slept? And he's like, well, I don't know now, you know, so sometimes that kind of data maybe isn't helpful. But yeah, if anyone else has worked with equipment at that level, I would love to talk to you about it. We have put equipment on households before, but it was kind of equipment that was like, people wouldn't really know what to do with it if they sold it, right? Like it's not a hot item on the market, whereas like a Fitbit would be something that you could sell.
There's a question about, for study 3, is the goal to reduce the average indoor temperature or to reduce the indoor temperature at night as much as possible to allow recovery?
The goal is to reduce the average indoor temperature. We will see what happens. You know, maybe people will use the intervention during the day when they're home. Maybe they won't use it in the day because, you know, only the baby is home and the baby couldn't, you know, close the window or something like that if that needed to be closed because the rain started, and so people would just close it anyway. Maybe people will be more excited to use it at night because they're all home. It's getting, you know, warm because everyone's home. So I think we'll just see what the idea is, but the data collection will be in the hot season from April to September. It's not hot all of that time, but the hot season is shifting due to climate change, and we don't really know when it's going to be hot. And so that's why we'll collect data over that whole period. And we'll look at daytime and nighttime temperatures sort of separately because they might have differential impacts. Okay, great questions. All right, so the last two are very, very brief, and then we'll have more time for questions at the end. We are interested in working sort of with Zoe Hempstead or others on sort of power structures and heat governance. My DRPH student who's working on this project has a lot of qualitative experience, and we're interested in looking at not just, you know, how hot is it, but why is it hot, right? And what are the barriers to cooling? So one barrier that we expect is landlords. Most people in this area are tenants. And sometimes tenants have limited ability to modify their house. or they will let us modify it for the study, but we have long-term concerns about feasibility because the tenant will say that the landlord should pay for it because it's the landlord's house. And the landlord would say that they're not currently reaping the benefits, so the tenant should pay up for it. Right. So those are some things that we'll explore. In the study, we'll give all the interventions for free. And so we're not going to run into that problem, but we are interested in sort of what could be long-term sustainable in the market. And then you'll need to know sort of who's in charge of purchasing the thing, who has the money, and who is actually benefiting from the intervention. And then moreover, sort of on the higher city level, Dhaka City North now has a heat officer, and they're working with an NGO on some like cooling plans. And so what does that mean for sort of everyday citizens? And how are those things implemented? And then another thing we'll look at is the sort of human right to cooling. Again, my dear PhD student, Kara, has previously worked with the Human Rights Watch, and so has a background in this. And we're interested in the human right to cooling and how it intersects with sort of the human right to health, the human right to an adequate standard of living, and human right to education. And the education one is that sometimes when it's too hot, you know, schools might close, or children might not want to go to school. I'm from Minnesota, so schools closed when we were too cold, not when we were too hot, but you can see similar reasoning, right? Of schools not having adequate ventilation or cooling. Even in California, that's happened. Schools don't have, a lot of schools, you know, weren't built for the hot climate that we're facing today and don't have mechanized cooling in them. And so it can be really uncomfortable. And then even if you do go to school, if it's really hot, you know, you might not be able to concentrate or things like that. So thinking about how this right to cooling can be linked to these other rights that already exist. All right, so I did a good job of leaving 10 minutes for any more questions you have or ideas for add-ons or any other suggestions. And I'll just say, you know, one thing that just came up at another presentation, for example, was looking at home wiring. So even if these houses did want to install, you know, more electricity intensive cooling solutions, are they prepared for that, right? What's the wiring of their home? What's the wiring of their neighbor's home? Are they connected? If one person had a, you know, big cooling system, is that going to make the other person not be able to turn on their light bulbs, right? So what would that be? And then at another presentation, we were sort of thinking about what would the cost of benefit of sort of current adaptations be to put the cost benefit of these new interventions into context. So yeah, really happy to take any other questions or ideas that people have.
Thank you so much, Layla. Wow, it's really sounds like a really ambitious project. Very exciting. Let's see, there are a few questions in the chat. Will you collect information on access to cooling measures on the individual level, or even access to food or water, etc.? And then there's a question from Marley about, are you planning to return results to participants and share the learnings? Some ethical questions around, you know, what the people will do with the information.
Yeah. So access to cooling measures. Yeah. I think part of the qualitative work in the second study will be what people are currently doing. There's currently only 2 studies on pregnant women's sort of experiences and adaptation, you know, adaptive practices to heat. And those are both in African settings. And so we're interested in adding to that literature. We're really interested in children because there's hardly any peer-reviewed literature on children's adaptation measures. There's some, you know, there's reports from UNICEF that have anecdotal evidence, but not a lot of other reports. So while I'm primarily interested in children under 2, for sort of their inability to move when they're exposed to heat, we're also interested in older children, you know, and impacts on education and sort of what they're doing to keep themselves cool. So we'll add that qualitative part about access to cooling and sort of costs of that, costs and benefits of that into study 2. Okay, returning data to participants. I might say something very controversial here. I know that there's an increasing emphasis on this as sort of an ethical imperative, but from my perspective, I only feel like it's ethical to return results to participants when there is a next step of action that they can do to improve their situation, right? I don't want to just tell someone that they have a disease and like, that's it, right? Oh, you have this, you know, sorry, that's a really bad example because in that case, you would refer them to the clinic and they could get treated. What are other things that I work on? I work on animal feces management, right? And children's exposure to feces in the environment. So if we, let's say, found out that your child had a specific, parasite, okay, great. I would give you that information back. I'd be like, you need to get deworming pills, right? Or go to the clinic. But if the information is, more general, like, your house is really hot, right? Like, it's not necessarily helpful to a person to get that type of information unless it's coupled with something else. So I think we will go back to the community ready with meeting with the heat officer, or ready for solutions that are ready for scale, that we know that could cost effectively cool people's houses. So I think another example is I work in the Rohingya refugee camp, and we collected information on their liquefied petroleum gas stoves and particulate matter of that compared to biomass stoves. I don't need to go back to a household and tell them that they have more particulate matter with their biomass stove, right? Like, that's not really useful to them. What I need to do is I need to go to the donors that fund liquefied petroleum gas, and I need to say, listen, it's way healthier if people don't have all this biomass in their house and their particulate matter, and that's how they'll see the change. So again, I share back information when I feel like it's useful to the individuals and they can make positive change in their life, but I don't want to share it back when it's just going to cause mental hardship, because now they know they have a quantified, problem, but they can't do anything about it. Okay, any other questions? Okay, for study arm 2, are you using a survey to capture exertional heat illness? Yeah, so heat illness. Do you mean by heat illness, do you mean specifically like heat stress or heat exhaustion?
Yes, that's what I was thinking.
Yeah, okay, actually that's a good idea. We have a tool that is used to assess thermal comfort that is tied to sensors and is rigged to send people a text message to fill out a survey if the monitor goes above a certain temperature. I think we could do the similar thing for rickshaw pullers, but it might be more manual. So maybe we'll just have sort of study staff monitoring daily temperatures and relative humidities, and on days that look like they'll be extra stressful, send the rickshaw drivers a text to, answer a 3-question, survey. And we'll tell them we'll pay for their phone credit, because that's often a deterrent for them answering text messages. But yeah, that's a great idea. Go do thermal comfort for the rickshaw pullers. It's funny that thermal comfort, even though it's sort of maybe especially because it is a self-reported measure, is still found to sort of correlate with health better than any other metrics for heat, just because heat is such a complex system of cascading reactions in your body, that sort of people's perceived thermal comfort is more telling than other metrics. So it's a great idea that we should also just ask them, in addition to collecting data from, the Fitbit or something else. Thanks for that idea.
Great, thank you so much, Layla. Really appreciate you sharing your work, and I'm sure if people have other questions later, you can always reach out to Layla by email. So thanks very much.
Yeah.
Really
okay. Thanks, everybody.
Take care. Have a good day, everybody.
Yep. Bye.